As the U.S. awaits FDA approval for that vaccine, health departments and hospitals are finalizing strategies for distribution. But as we're learning, rural areas may struggle with access and resources, especially within the Amish community.
We're a small rural health department.
And that's why Marcus Cheatham, the health officer for the Mid-Michigan District Health Department, says they'll be more like coordinators as COVID-19 vaccines become available.
Most people are going to get it through their healthcare provider. So we'll be looking at the gaps in the system. Who's not getting it through their healthcare provider? So that could be people in adult foster care, folks like that.
Cheatham says the biggest hurdle in areas like Montcalm, Clinton, and Gratiot counties is being a bit behind the curve.
Some of the higher mortality rates in rural Michigan for chronic disease is just due to our lateness in basic prevention.
And he says they'll have an additional barrier in vaccinations within the Amish community.
They're not on TV, they're not on the internet, they're not getting those encouraging health messages that a lot of us see on social media.
That's why Cheatham says it may come down to going door to door, letting them know that they may qualify for a vaccine if they're high risk or over 65 early on.
When we have had some outbreaks of things like pertussis or things like that, families have come in to get vaccinated. And what we expect is that that's what'll happen again. We'll just need to get the information out to them.
The MMDHD has been overwhelmed with contact tracing efforts. And since they can't access many Amish families on the phone, they're unsure how COVID-19 has affected them, but says they've likely stayed away from big gatherings.
And of course, those events in the general population have spread COVID like wildfire. Unfortunately, I hope the Amish have been somewhat protected from that.
And while there may be concerns about potential religious barriers in the Amish community, Cheatham says that some groups do tend to be receptive to medical care. Meantime, he adds that they are most concerned with the general public accepting a vaccine that's so new, even with its promising trials.
And the consensus around prevention that used to be there in the United States is not there. And so in everything that we're doing now, we're running into the challenge of people not trusting the science or not feeling that prevention is an activity that the government should be involved in.
And Cheatham says that they expect to be able to vaccinate healthcare workers and people in long-term care facilities starting in January, and then move on to what they call phase 2 distributions for the high-risk populations sometime in February.